response to some other claims, first I'd like to talk about, what if PEDs didn't exist? Obviously there would be a whole different scheme of, who is a top athlete and who's a number one and who are you gonna look up to and whatnot. But, obviously also the history would be completely different as it is now. But, we are in reality and PEDs do actually exist. So, for example, Ray Lewis, who did a quick recovery, who is also under question of using PEDs, although everyone is excited about his quick recovery. What if he had never recovered? Would the game still be existing? He is one of the top-notch players, and everyone looks up to him. Why isn't anyone questioning Ray Lewis and his miraculous recovery? Obviously, there has to be a scheme behind this on, most likely he used PEDs, just because, you can't just recover right away from a really bad injury within like a couple of weeks, So, then you start thinking about sports, what is being allowed, what isn't being allowed, what is being controlled and what isn't, So you really have to, there needs to be some sort of course, regulation about this, but it needs to be legalized and controlled, for doctors. And, speaking of doctors, I did want to talk about, how sport physicians are stuck in between the tie of helping their patients do PEDs safely or to lose their job for not doing what they are needed to do. According to a journal called Juridical and Ethical in Doping, in the Journal of Medical Ethics, sports physicians are only able to be a productive source of medical knowledge for a team if they have invested in their education and experience for a long time. This holds particularly true for those sports where PED is an important issue. For independent of the question, if the physician is employed to actually prevent PED use, which we do not want to exclude upfront, or his task is to support PED use but not be a backup for the manager, he needs a sound knowledge of up-to-date PED techniques. Or he will either have to implement PED use in a way that is technologically ahead of the control mechanisms installed to detect drug use, or he needs to be able to detect PED use in an athlete that might be deciding on drug use on his own or by help of a privately employed doctor. In any case, it is reasonable to assume that the team physician is a top-notch expert in sports medicine. So this, these doctors that are being hired, for these things, they have to obviously be very well-rounded about PEDs, and they are kind of stuck in the middle line of, should I help my client out in, using PEDs safely, or should I just lose my job? So you really have to take that in consideration, because there's a lot of jobs being lost here. Just another claim. PEDs is sometimes even safer than the actual sports. Look at all the, head concussions that you're getting in football, all the arms that are being, strained for, throwing hard balls and whatnot. So, that's another reason, instead of spending money on catching the users, is just spend money on legalizing PEDs and finding an appropriate way to actually, find it safer for athletes to actually use PEDs.